excludes one. All right, I know that you know this, but this is so important because what does it mean? It means that you can't code that code with the associated code that you've looked up. It's not appropriate. It's going to be kicked out. Your bill is going to be denied. Okay, so right off the bat, we want to pay attention to the excludes one notes. All right, but we also know in this convention that there's an exception. And that is when the two conditions are unrelated. How do you know that? That's a question that we all ask at times. When the chart is not clear on whether the conditions are related or not, you're going to have to send a note to either your coding manager, or if you're working directly with a physician, to the physician, because you have to ask. You cannot assume. The examples that they give us is somatoform disorders with sleep-related teeth grinding. Okay, what is somatoform disorders? That is actually a mental condition, a condition that affects our mind, that the symptoms are bodily related, such as pain, neurologic symptoms, such as the teeth grinding is a symptom. Okay, so when we look up, you go back. All right. All right. So I keyed in, my keyword is disorder, and then my adjective, what kind of disorder, is somatoform. So I'm going to click on that. Okay. Let's open up, because we know that we have a condition. All right, so F45.8. All right, so I've got a specified condition with my disorder. When I get to F45.8 and I see here and excludes one, sleep-related teeth grinding, coded to G47.6, can I assign G47.63 with my F45.8? No. So I would only use one code, which is your F45.8. Because I do have a specified disorder. Now, what about the example that is in the conventions? Talks about the conditions that are unrelated. So here we've got psychogenic dysmenorrhea. All right, all that is menstrual cramps. And the patient has teeth grinding. All right. Your dysmenorrhea and your teeth grinding are not related to each other. So the code for psychogenic dysmenorrhea is F45.8, and you're going to also code your teeth grinding. If we look here at our F45, our inclusions, we see psychogenic dysmenorrhea. We still have that excludes one note, but we easily can know by the definitions that the dysmenorrhea and the teeth grinding are not related. with excludes one, as a coding tip, I put, just make a note. When you see an excludes one note, that means only one code should be assigned, except for that exception when they're unrelated. And there again, when you're in the office and you're just not sure, you're going to have a coding manager, or like I said, you're going to work directly with the physician. You've got to inquire, you've got to ask.